The appendicular skeleton. The appendicular skeleton includes all bones of the upper and lower limbs, plus the bones that attach each limb to the axial skeleton. There are 126 bones in the appendicular skeleton of an adult. The bones of the pelvic girdle include the scapula or the shoulder blades, the clavicle or the collarbones. It connects the sternum to the scapula. And the acromion, which is the extension that forms the bony point of the shoulder. Bones of the upper limbs. The bones of the upper limbs include the bones of the arms, wrists, and hands. Bones of the arm include the humerus, which is the bone of the upper arm, the radius, the bone that runs thumb side of the forearm, and the ulna, the bone that runs the side of the little finger of the forearm. Bones of the wrist and hand. Carpals are the wrist bones, metacarpals are the bones in the palm of the hand, and phalanges are the finger and toe bones. Each phalanx has 3 bones, the distal, medial, and proximal. The exception is the thumb and big toe, which has 2 bones, distal and proximal. There are 30 bones in each upper limb. Bones of the pelvic region. The bones of the pelvic region protect the reproductive, urinary, and excretory organs. The pelvic girdle is the hip or coxal bone. It is formed by the fusion of 3 bones during adolescence. The ilium is the largest part of the hip bone. The ischium is the lower portion of the pelvic girdle. The pubis is the anterior portion of the pelvic girdle. The pelvis consists of 4 bones, the left and right hip bones, as well as the sacrum and coccyx. The acetabulum is the large socket in the pelvic bones that holds the head of the femur. The shape of the pelvic girdle is different for males than females. In the male, it is funnel shape. In the female, it is shaped like a basin to accommodate for the fetus during pregnancy. Bones of the lower limbs. The bones of the lower limb includes bones of the leg and the feet. Bones of the leg, or the femur, is the thigh bone and is referred to as the upper leg bone. It is the longest and strongest bone in the human body. The patella is the kneecap. The tibia is the shin bone. It is the medial bone and the main weight-bearing bone of the lower leg. The fibula is the smaller of the lower leg bone. Bones of the ankles and feet. Tarsals, the ankle bones. There are 7 total. The malleus, the bony protrusions of the ankle bones. The talus, the superior ankle bones. The calcaneus is the heel bones. The metatarsals are the foot bones. The phalanges are the bones of the toe. The physiology or function of the skeletal system. The bones of the skeletal system is comprised of an inner spongy tissue referred to as bone marrow. There are 2 types of marrow, red and yellow. The red bone marrow produces the red blood cells, and it does so by a process called hematopoiesis. The yellow bone marrow contains adipose tissues, which can be a source of energy. The bones of the skeletal system also store minerals such as calcium and phosphate. These minerals are important for the physiological processes in the body and are released into the bloodstream when levels are low in the body. Most bones connect to at least one other bone in the body. The area where bones meet bones or where bones meet cartilage are called articulations. Joints can be classified based on their ability to move. At movable joints, the articulating surfaces of the adjacent bones can move smoothly against each other. However, other joints may be connected to each other by connective tissue or cartilage. These joints are designed for stability and provide for little or no movement. Importantly, joint stability and movement are related to each other. This means that stable joints allow for little or no mobility between the adjacent bones. Conversely, joints that provide the most movement between bones are the least stable. Based on function of joints, there are 3 types of joints. A synarthrosis joints, which allow no movement, and an example is the joints of the skull. And amphiarthrosis joints, which allow some movement. Example is the pubic symphysis. And a diarthrosis joint, which allow for free movement. An example is a joints of the knee. Structures associated with joints are cartilage, the elastic connective tissue that is found at the ends of bones, nose tip, etc. Synovial membrane, or the lining or covering of synovial joints. Synovial fluid is the lubricating fluid found between synovial joints. Ligaments, or the tough elastic connective tissue that connects bone to bone. Tendons, the fibrous connective tissue that attaches muscle to bone. Bursa, the closed, fluid-filled sacs that works as a cushion. Meniscus, the C-shaped cartilage that acts as shock absorbers between bones. Body movements. Synovial joints are movable joints and provide most of the body movements. Body movements occur when the bones, joints, and muscles work together. Flexion and extension. Flexion and extension are movements that take place within the sagittal plane and involve anterior or posterior movements of the body or limbs. For the vertebral column, flexion or anterior flexion is an anterior forward bending of the neck or body, while extension involves a posterior directed motion such as straightening from a flexed position or bending backward. Lateral flexion is the bending of the neck or body toward the right or left side. These movements of the vertebral column involve both the joints as well as the associated intervertebral disc. In the limbs, flexion decreases the angle between the bones or bending of the joint, while extension increases the angle and straightens the joint. You will discover in the muscular system that the associated muscles to these movements are flexor and extensor. Abduction and adduction. Abduction and adduction motions occur within the coronal plane and involve medial lateral motions of the limbs, fingers, toes, or thumb. For example, abduction is raising the arm at the shoulder joint, moving it laterally away from the body, while adduction brings the arm down to the side of the body. In the muscular system chapter, you will discover that the associated muscles to these movements are abductor and adductor. Circumduction. Circumduction is the movement of the body region in a circular manner in which one end of the body region being moved stays relatively stationary while the other end describes a circle. It involves the sequential combination of flexion, adduction, extension, and abduction at a joint. Rotation. Rotation can occur within the vertebral column at a pivot joint or at a ball and socket joint. Rotation of the neck or body is the twisting movement produced by the summation of the small rotational movements available between adjacent vertebrae. At a pivot joint, one bone rotates in relation to another. Rotation can also occur at the ball and socket joints of the shoulder and hip. Here, the humerus and femur rotate around their long axis, which moves the anterior surface of the arm or thigh either toward or away the midline of the body.